All right, guys, we're here today. I am at my PT with my physical therapist, Dr. Marone. Is that right?
Marin. That's okay.
Marin? Okay, Dr. Marin. So she's going to do some fire cupping, and she can go ahead and explain what she's doing.
So with the fire cups or with any type of cupping therapy, our goal is to get increased blood flow to the tissues. So vasodilation, opening up the blood vessels to bring blood flow to tightened tissue areas or injured tissue areas. The darker that the bruising or circles that you see on people are, means the lack of blood flow, lack of tissue elasticity, lack of movement of the tissue. So with Jovana, she's got a significant amount going on in her low back. She actually, on her MRI, shows stenosis, which is a hardening and stiffening of the spine and her lower spine, right around where the sciatic nerve comes out. And she also has some herniated discs at the lower level. And she also has an SI joint dysfunction, which is where the sacrum, or that triangular bone where your sit bone is, meets your other two sit bones, or where your dimples are in your back. So we've been doing a lot of core stability work. We've been doing a lot of nerve glides, nerve flossing, and a lot of traction to open that up for her. It's a little different than a regular herniated or bulging disc case because we have to work into account that she's got the other issues going on as well. So we're avoiding a lot of extension movements, which a lot of therapists will usually go to extension-based exercises with a herniated disc. And I'm going to add two more. So going back to that, we're kind of getting out of extension for her, biased about this opinion for this position for her, but she's okay right now. I got her feet up. So any type of incline treadmill and stuff like that, I'm having her really try to avoid doing at the gym, and it's been helping. So she's had really little to no pain in that left area and her right on her SI joint. I'm looking for my lighter. It's here. We're gonna do this one more time. Here. And the key is not to burn anyone. I enjoy using the fire cups a little bit more. I find that you get more of a deep heat tissue. So instead of someone just putting you on a hot pack and then doing the cupping separately, it heats the tissue up a little bit deeper than I can with my hands and much quicker. So then when I go in there afterwards, I can get through that tissue layer and really open her up. She also has significant piriformis tightness in her, right underneath her butt. She's actually pretty pinpoint tender on that. And your piriformis is one of your hip external rotations, so this motion, right? So that's very tight on her. So we've been doing a lot of active release motions for that and strengthening her rotators of her hip to kind of open that up. She's been doing great. So this is her 4th visit, and she's literally had, no pain the past couple of days? She's been
great.
Pretty good. Sleeping's been good. Getting up from the chair has been pretty good.
Definitely.
So a lot of modifications go into that as well, and having a patient that actually does her homework is huge. And she's really dedicated to getting back in the gym. So today we're actually going to progress her to a little bit more unsupported position. So a lot of her beginning exercises that she's been working on has been more supported, meaning she's been on her back, she's been either side lying. So today we're actually progressing her. She actually has been doing a bird dog, which is on all fours. Today I'm going to progress her to more core strengthening, deep core strengthening in a half kneel position. Then obviously I progress her to a full kneel and then standing. We're going to throw in a little bit of mini squats today so she gets a taste of what that's like again.
Ooh, I'm excited for that.
Yeah. So, it's getting her back into the gym and doing her thing with some modifications. A lot of people will say, oh, you need surgery and stuff like that, and that's not necessarily the case. I've had a lot of bodybuilders, powerlifters come in that have fractured vertebrae or discs in their back and kept competing or kept doing their thing, and all they really had to do was just learn some specific movements and exercises to maintain in their program to keep them strong. So here's the other stuff I use. I use Graston tools. I'm actually a Graston certified technician, specialist they call it. I went through the 2 classes and then I took the test. Now the grassin is not to get rid of scar tissue, which a lot of people believe that's what it's for, and it's not. So if you actually take the course, they'll talk to you about how it's supposed to modify your tissue. So what we're doing with Jovana is right now I'm going around her SI joint on the left because that's where she's symptomatic. She's actually found posteriorly rotated, so her hip on the left side is actually back. So a lot of what we've been doing are muscle energy techniques to flip her pelvis forward again. And she's been doing really great with that. So with the tool, I'm actually framing around the SI joint. You guys can feel yourself around those little dimples in your back, that there's 2 little bones there. So I'm going around the tissue, and it's much better than it has previously. Sometimes in the beginning, you'll feel more crunchiness, and then more often that you do the grassin, it goes away. And that's how I explain to people, your tissue is, I eat spaghetti a lot, so don't mind me, I love spaghetti. I like to say that your tissue looks like, if it's injured or tight or restricted, it looks like cooked spaghetti in a strainer. Right? You know, when it's dry and you're trying to pick it out, and it's nasty. So what the tool's implemented to do is realign that tissue so it looks like uncooked spaghetti again. Nice and straight, nice and linear. So like I said, just going around our SI joint. You have a lot of ligaments that go around the SI joint as well as the pelvis in the back. So working on those specifically too is pretty important. And then I go around her spine and detail around on her spine because there's a lot of ligaments around there. And then I also go into in between the vertebrae, which we have interspinous processes or ligaments. This one's red, I'm sorry. And that helps opening up the ligaments as well. So right here you can see me, I'll go right in between each vertebrae. So I'll show you on this. So this is what her back looks like. Right, there's ligaments that go in between these 2. So with the tool, I'm actually going in right in between and opening that up. And then you can also go out on the side on these transverse processes here and here and here and open up all of that for her. So go in.
It feels better actually than the first time that you did it, yeah.
Alright, so I'm going to work my way down. I'll save the cupping on your... Push it a little bit.
Alright.
Much less red than she normally is. So we're going to go in with the grassin now. I'm going to work all around her paraspinal muscles in her back and just kind of open this up. So like I said, with the heat cups, I actually bring a good amount of blood flow, and you can feel the tissues really deep heat.
Mm-hmm.
So even though she is more symptomatic on her left, we've been addressing the right as well. It's important that we take care of both. Here I'm just going to do a little bit of detail out from her spine. And then, like I said, I'm going to go in between those vertebrae. So I'm feeling in between those spinous processes like I showed you guys on the model. And I'm working on all those little interspinous ligaments. So with the SI joint dysfunction that she has going on, we're trying to get that pelvis to be more forward on the left side. And now I'm just framing around her sacrum. Grassin, you should always bring some blood flow or a little petechiae, they say, to the tissue, but it should never bruise you. It might bruise it later, but it should never bruise you. You should never, as a therapist, get to the point of bruising. Always just want a little bit of blood flow, a little bit of petechiae, which is like that little bit, that look of almost red dots.
Mm-hmm.
just doing a little manual therapy for her here. I'm going to do some sacral rocking. So I'm going to get right on the sacrum, that big triangular bone, and I'm just going to rock it. Nice and easy. Now Jovana also has very tight hamstrings. So that's been something we've been working along with the sciatica that she has down the leg. So it's a little bit of a catch-22.
Mm-hmm.
So what we have to work on is dynamic hamstring stretching with a sciatic nerve glide.
My favorite exercise.
You're killing it though.
Yeah, for sure. I mean, I was excited. I was like, I'm gonna up it up like 10 more, because I remember the first 10 did hurt.
Yep.
So now it's like it's becoming a little easier, and I feel like my leg is even lifting a little higher.
Yep.
So.
Now our main goal for Jovana is getting her back in the gym, getting her back to working out and doing her thing without having any discomfort. And as long as she keeps that core nice and tight, she'll be okay. No surgery.
Definitely no surgery.
No surgery. Okay, relax. Alright, so I'm going to do a little bit of hip mobility work for her. This one's been much better. So I'm just pressing on the edge of the sacrum, blocking the motion of that joint, and passively motioning her leg. And try it on the other side.
Mm-hmm.
So we're going to do a little bit of release here. Oof, you feel that, I know.
Mm-hmm.
So she's actually a little bit more symptomatic on her right side, which is why I said you should always take care of both, because for a while she's been compensating on that right side. So all the tissues in the right side of her body have tightened up and stiffened up. So self-care all around. You want to show them traction or the
what?
the traction on your back?
What's that?
Or the nerve glides when I had
Oh,
you
yeah.
hooked up?
Yeah. All right.
Because I'll save this stuff
For after?
Yeah.
Okay. All right. Thank you.
You're welcome.
How do I do this?
So now we're gonna do tractioning of her spine. You can, it's like the inverted table. I know a lot of gyms end up having it. But I'm gonna use a gait belt. I'm gonna do it manually. Works just as well. We're gonna hang out for like 5 minutes in this position. So I'm wrapping myself to her, to the belt. Now there's also things such as traction tables out there and stuff like that. One day, hopefully I will get that. Those things are pretty pricey. But like I said, manual does it just as well. And the key is, as a therapist, is to not kill your own body. So the purpose of traction is to actually take that spine, right? Tell me when. Feel that?
Right there.
Okay. So it's to actually take the gap of the bone, of those two bones I showed you, and open that up, right? And opening up the joint, you can traction any joint in your body. You can traction your wrist. You can traction your shoulder, you can traction your leg, your hip, just by pulling that joint apart. And it feels great to everyone because it takes pressure off the disc, takes pressure off the nerve that's exiting out the canal, and it takes pressure off the joint. If you're someone who has, let's say arthritis in the hip, arthritis in the knee, you can do a nice long traction for a couple minutes, and it takes a lot of the pressure off.
This is like the best part.
Right. So with the stenosis, because a lot of what she's got going on is bone on bone back there. So this feels really good to her because it gives that pressure off. A lot of our bones, on the tops of our bones in our joints, have a lot of nerve endings. Mm-hmm. So that nerve to nerve pain is unbearable for a lot of people. So if you're able to kind of traction that joint, it feels phenomenal once you do it. So all I'm doing is I'm just pushing back with my pelvis. I'm attached to her. Her feet are planted, and that gives that lower lumbar spine a nice big gap in her joints.
How we hang out.
Usually I have Netflix on.
We'll have Netflix on, or this is just how we chat for the next 5 minutes until we go into the next.
Actually, I get a cup of coffee.
Right? All right, guys. I am ending the live session, and hope you guys enjoyed, and hope you guys have an amazing day.
Bye, everyone.
Bye.